listening to you and the other comments, I was thinking of three different alternatives for what might happen with payment. There's status quo, the fee-for-service system, by and large, where with increasing cost pressures, I think inevitably leading to payments that are increasingly inadequate for meeting practices' expenses. Elsewhere in the spectrum, there's sort of revolution and evolution. You know, a revolution would be like big drastic change in payment policies that, you know, it's like rolling out the model that you described. That would be revolutionary, and and I would say the vast majority of practices would not be ready to handle it. And then is there something in between, an evolution that may not happen as fast as people would like, but it won't be as disruptive to care as, you know, a sudden dramatic change the way you pay for people.
Actually, there are a lot of proposals that are evolutionary. So the Medicare Physician or Payment Advisory Commission, they think that, number one, primary care physicians should just get more payment for each visit than they're getting now. Plus, there should be some kind of care coordination fee per patient for all the time we spend in between visits, coordinating with the rest of the healthcare system, plus some kind of pay-for-performance system. That's what I think I'd call the evolutionary system. I think it might help to pay primary care more, but I don't think it gets away from the fundamental visit-based problem, so I don't think it's adequate. But I think it's more likely what's going to happen.
I would have revolution, but in evolutionary fashion. Number one, strategy one, we fixed the current primary care infrastructure cadre by giving them an incentive. If you will reorganize your practice in whatever way makes sense to get at the Starfield goals, then we will now, and this would be a new kind of social contract, we will now pay you in the revolutionary manner. And if you don't change, guess what? You can get RBRVS, visit-based, maybe with a few, you know, survival mechanisms tossed in to keep the lights on, and you'll just muddle along, and that's the way it will happen. So that you would then, in essence, come up the capability scale, and when you reach a certain level, you would then be accredited for payment under the new system. So that's a way of melding the evolution and revolution. Now, one comment about that. Barbara's right. If we don't change the medical education system in the United States, we are not going to be able to meet the need. So what I would say here is that to the students coming in, is that it's very important that the revolutionary system be in place, because as a student choosing a career, that is now an option for how to do things. And if that option is there, if we actually know that we have a viable alternative by coming up, training appropriately, learning about how to do teams and information technology and working effectively, that's what we can aspire to.
The revolution is medical education. And we do have to change the incentives in medical education. I mean, I think we could dwell on this more, but I won't. But that's a revolution that we have to have quickly. The semi-revolution is the payment reform. And the evolution is to start thinking about how we change our own practices so that we're responding to patients' needs. Not needs as we see them, but the needs as people present them.
We have to reform payment, because right now what we're trying to do is a lot of practices are trying to change sort of one practice at a time. Well, there are hundreds of thousands of primary care practices in this country. To change them one at a time is going to take forever. Real payment reform will really encourage and dictate that a lot of practices are going to change quickly. However, the plus is that the practices need assistance in becoming really good primary care practices. So part of the payment reform has to be that there have to be some kind of, I'd call them practice improvement teams or practice improvement consultation, to go to the practices and help them to make the changes they need. And there are people who are very good at doing that, but I think those practice improvement teams should have patients on them, because otherwise we could go wrong.
Well, I want to thank all the panelists. It's been an interesting discussion, and actually one thought that ran through my mind is listening to all the changes that you're calling for and the references to evolution is, well, next year is the 200th birthday of Charles Darwin, and one of his comments on evolution was that the species that survive are not the strongest and they're not the most intelligent, but they're the ones that have the ability to change. And clearly the changes that you're calling for are important. We'll see how nimble our healthcare system is. We wouldn't bet on it being extremely nimble, but I think we will change because I think we have no choice. And I think that these insights will be useful to the readers and the viewers. Thank you very much.